We have a speaker today, Christy Blackburn. She is an associate professor in health policy management at Texas A&M University School of Public Health. She is also a center-affiliated faculty member with the USA Center for Rural Public Health Preparedness. Christy is primarily a quantitative researcher with research interests healthcare access for those without legal status and other vulnerable populations. Um, Emergency medical services, and other topics related to border health. She also has an extensive background in pandemic preparedness and responses, specifically in understanding the impact of pandemic and pandemic response on vulnerable and marginalized populations. So her topic today is developing mixed method studies using survey data to create semi-structured interviews. So, Christy, yours.
All right, thank you. Okay, so thanks everyone for having me. I just want to preface this by saying, like, the way that I put this together was for it to be pretty informal, and I also am not sure of everyone's baseline or like comfort level with mixed methods or qualitative. And I know some of you have probably been doing mixed method studies much longer than I have, and so what I wanted to do was kind of give an overview of what mixed methods look like, but I wanted to approach it from the qualitative perspective as opposed to kind of the other way around, which I think is more often how we discuss mixed methods. And with that said, it's going to be kind of this broader overview, and I would love for you guys to ask questions throughout the process. I'll kind of make sure to pause and not just kind of force feed you information. So can we go to the first slide? So this is what we're going to do. I'm going to give you kind of this really broad or kind of overview. What does mixed methods research design look like? And then what I wanted to do was talk specifically about the Waiver project, because I think that makes it a little more tied into something tangible and hopefully gives you like a concrete example of what I'm talking about. And then I wanted to walk through with you, and I'd love your guys' feedback into it as well. It's like, based on what we're talking about for the survey for the Waiver, how would you put together an interview? How would you frame certain interview questions so we can be a little more interactive at that point? So that's what we're going to be doing today. And I just like the comic, so that's why that's there. All right, next one. So next slide. All right, so I want to go over first, what are some of the benefits to mixed method studies? What are some of the challenges? And what does it look like in general? So when we talk about mixed method studies, what are some of the reasons that you guys think we put them together? Like, why would you choose a mixed method study as opposed to something that's qualitative only or quantitative only? Yes.
Qualitative methods are inclined to answer certain research questions. Quantitative methods are really well suited for quantitative methods, but there's sometimes where you need insights from both of those types of research questions to know how to move forward. So mixed method really offers a nice blend.
Yeah, exactly. So it offers a nice blend. It lets you answer questions in a much broader manner or a much more in-depth manner. And it also, by using like overlapping and different methods, you can actually find ways to adjust to help accommodate for the weaknesses of any given method. So quantitative methods have certain weaknesses, qualitative methods have certain weaknesses. And by creating mixed method studies, you can kind of address, not completely, but you can kind of address some of those weaknesses that might have otherwise existed if you were doing it with only a certain type of approach. Now, there are some people who like to say, instead of mixed methods, so this is just kind of an aside, they like to say multi-method, because there is an argument that saying mixed methods implies that it's like a method that doesn't fit. And multi-method, it's like actually just different methods coming together to work on a problem. So some of the benefits, right? So I already mentioned this, but you can increase the breadth or depth of your project. And what qualitative data lends specifically is qualitative data is always the how and the why of something. So if you have quantitative data, you have all of this information, and you might be able to say, like, this population does this thing, we can see that, but then qualitative methods can say, why do they do that? Why are people making these choices that we're seeing in our quantitative data? Also, as Hannah mentioned, combining the two methods, adding qualitative methods to your research can let you answer different parts of the research question that you wouldn't otherwise be able to answer. So if you have a research question and your quantitative methods are only addressing one part of it, adding qualitative methods to it can then allow you to address the full research question. The third one is triangulation. And so I do want to mention that when I say triangulation, because I think everyone in here does quantitative methods, right? Yes? What do you think of when I say that? What is triangulation? I guess it's people, but
Building two different bodies of information to see if they're pointing to the same.
yeah, so you're looking at different ways to kind of validate your information. Qualitative methods has triangulation, but it's done differently, right? So I think, and for those of you who are quantitative, please correct me if I say this inaccurately, but in quantitative methods, triangulation is making sure that you have the quote unquote truth, like what I'm finding here is accurate. Qualitative methods are a little more fuzzy because truth is more in the realm of like socially constructed ideas, people's perceptions and experiences. So you still have triangulation within qualitative methods, but what you're talking about is more like, is the data I'm getting, is it providing a deeper understanding of what we knew before? Because you're not going to be able to really say, I can 100% show you that this person's experiences are true by triangulating it. Right, so you have a different idea of how triangulation works, but using qualitative methods and quantitative methods can either help you in that triangulation process, so you're further validating your data, or sometimes because of the way the two methods work, you could get different outcomes. But that's important as well, because maybe your qualitative data is telling you something and your quantitative data is telling you something else. And so now you need to figure out where this disconnect is in your data. And then the last benefit of using mixed method studies is that, well, there's more benefits than this, but we're going to just focus on these, is it can help enhance your generalizability and your transferability of your findings. So one of the greatest limitations of qualitative data is that it's not generalizable. Like that should, I always tell people, like that should be the beginning of your limitation section of your paper. Like this is not generalizable. This only speaks to the people that were part of this study. And so providing quantitative elements to that can make it more generalizable. But I think also one of the things is that within quantitative methods, you can say, you know, we have this information, but qualitative methods can lend to you like in what settings and in what circumstances, the how and why, right? So does this work, which can actually allow you to understand what context it will transfer to most effectively compared to other contexts where it might not transfer quite as effectively. And I will say, like, policy evaluations tend to really like mixed method studies because you need that larger data. You need to know what's going on. But for a policymaker, the case studies and the stories are a really good way to tell like what is happening. So a lot of times policy evaluations will want to include a qualitative section so that they can do that. Okay, next slide. Okay. Oh, any questions about any of that before I move on? Okay. So some of the challenges that you can run into is most of them are related to how the study is designed in the first place. So it's really important when you're designing a mixed method study that it is a collaborative process throughout that, right? Because every researcher in it has their different skill set. You have your different thing that you're good at, your different thing that you understand. And so combining qualitative and quantitative methods is going to require compromise and adjustment on everyone's side to make sure that you're designing the best possible project. And I'm actually going to skip to the paradigm mismatch because it's more related to the first one, and then I'll come back. But a lot of times when mixed method studies are designed, they might be designed from one perspective of the other. So if the study was originally designed as a quantitative study, and then you want to have a qualitative element, you can a lot of times have this paradigm mismatch that's happening because quantitative work, not always, but tends to be more in the realm of this like positivist approach of looking at data and the world and all that. Qualitative methods do not fall under that paradigm. I don't want to be an absolute and say never, but like I would say very close to never. So if you've structured a study where its overarching approach and its underlying assumptions are within this positivist paradigm, it's going to be really, really hard for the qualitative work to fit in there. So the qualitative work is going to have to be structured, or it's probably going to be structured using other assumptions. So depending on how you are structuring your project, you can have this like mismatch of approaches, mismatch of assumptions that you're working with, even though you're trying to answer the same research question. So that can present challenges. Yeah.
So I'm not so sure what you mean by the paradigm.
Mm-hmm.
You would elaborate on what you think is the paradigm that you were talking about?
Yeah, so when I use the word paradigm, I'm thinking about the overarching like worldview from which you operate within when you're conducting your research.
And then you said, so I skipped the word because I don't think I caught it correctly, but you said often in quantitative, it's done with this paradigm, whatever this was.
Positivist.
So what?
Yeah.
So I didn't study social sciences. I've never heard that before. So what do you mean?
Oh, yeah, no problem. That's a good question. So positivism is essentially the idea that there is an objective truth. It's out there, and even if you're not looking for it, it exists. And then your goal throughout your research is to find the objective truth. So I think a lot of times, so there's variations, true, like, and positivism is like your high level, broad umbrella, and then underneath that are different theories that draw from the general paradigm of positivism. So quantitative work most frequently bases the underlying assumption that there is a truth that we can find out there, whereas qualitative methods are more frequently, not always, but more frequently based under the paradigm of like constructivism, which is the idea that, again, this is the scale that goes every way, that goes all the way down to nothing exists, there is no truth, and we're just all like wandering around in the world. But mostly it's this idea that the interaction of people with the environment actually creates a truth. So there is in some way objective, there's truth, but truth is dependent on the individual experiences of people, and that the truth is somewhat constructed by those experiences and perceptions. If that makes sense.
It does. So are you saying that like a mathematical theorem or an equation, is the absolute truth, and that under the positivism, is that word?
Yeah, positivism.
So that the paradigm is that whatever it is, the topic that you're doing research on has such a thing, and our goal to do the quantitative is to go find that. Is that what you're saying?
Yeah, that's the idea of positivism. Yeah. So, but like I said, there's different theories under it. So like you would have realism, or like rational choice, or bounded rationality, which is like a more constructivist version of rational choice. So you have these, that's like the broad statement of what positivism is. Like there's a truth and we are going to find the truth, but then there's nuances based on critiques of certain scholars who said, well, different things. But that's like the main difference, is that there is an answer that we can find, and then constructivism is like there's not necessarily one answer. It depends on the environment and context of the situation.
I think we should have another conversation. Because you would think I would know this, since you were saying that's the paradigm I'm supposed to be using. But I can clearly see this would be a very interesting conversation to have otherwise. But I'm not going to distract you too much. I had to understand what the mismatch was. I think I get that.
Well, hopefully I explained it at least well enough for the time being.
Sure.
So a lot of times this can happen, this kind of mismatch, because as we all sort of know, understanding the assumptions of your research is going to be important to understanding how you're interpreting it at the end of the day. So if you have a mismatch between the qualitative methods and the quantitative methods, that's going to present challenges when you're actually looking at what all of your data means. Some of the other challenges of mixed methods, and this is more, this also applies to qualitative work, is that it can sometimes be very resource intensive, and that's just not like money, that's like, if you have to go out and collect interviews and sit there and do this stuff, it can be very resource intensive. So that can kind of be a challenge with putting the projects together. And then kind of tied into all of this, it can be difficult to choose the appropriate design. So there's a bunch of different ways that you can design mixed method studies, and it can be difficult sometimes to choose which mixed method design you want to apply for your specific research question, because you got to pick the design that fits most with the research question that you're trying to answer. And so I kind of just made some notes on the different types of designs in case anyone is interested. But you can have convergent designs, right? So you have your qualitative portion and your quantitative portion working at the same time through the study. You can have explanatory sequential designs, which means you're doing your quantitative part first, and then you're using your qualitative part to add more depth to your quantitative part. Or you can do exploratory sequential designs, which is the opposite way. You're starting with your qualitative work, and then you're creating quantitative part afterwards. You can have embedded designs, which means like this most frequently happens when you have a quantitative project that just adds a qualitative component to it. And then you can have, I think, transformative designs, which is this idea that everything is under this overarching theoretical framework, and you have your methods, and then as you go through the process, your theoretical framework is gonna change and expand based on what you're doing within your methods. And then the last one is a multi-phase one. So you're kind of like developing, implementing, evaluating as you go through the design process. Any questions about that? Okay, so now I think I don't know how much time I'm supposed to talk for.
We have an hour and a half, you can go as long as you like.
Okay, okay, so the next slide. Okay. So then I just wanted to add some about policy evaluation specifically, and I think we talked about this, but one of the benefits for policy evaluation is it can provide you a more holistic understanding of what the actual policy impacts are of whatever design or whatever evaluation you're trying to understand, whatever policy you're trying to understand. And it can also help you like look at if you're getting, and we can go through more examples of this, but like if you're getting one answer and then when you actually talk to people, you're finding out it's like it is sort of that answer, but there's these other elements of it, or like we think this is what's making the policy work, but then when you talk to people, it's actually something different, but it still falls within that original concept that you were talking about. So it can kind of get you to understand what the policy impacts really are. And that kind of relates to like knowing how and why it's working, not just if it's working. So you get all of that put together. And then you can identify the specific barriers and impacts of something. All right, so now I want to talk about, can we go to the next one? Thank you, and you can go to the next one. Okay, so then I want to talk about how this applies specifically to like a waiver project. So it's a little bit more tangible and hopefully a little more concrete for everyone. So I sampled at random from the survey just some different types of quantitative measures that are going on, right? So, and this is not the questions, this is just kind of the concepts that were pulled from the survey. So are DPPs and SPPs, whether those are helping to expand services for different types of clients, if the programs are helping them continue serving Medicaid clients, if reimbursement costs challenges have changed, right? So these are, and then I kind of put the way that they're being measured, Likert scale versus yes or no, and things that may prevent organizations from adopting these different alternative payment models, right? And that's a multiple choice. So when you're getting this data, you're getting your Likert scores, you're getting your yes, no, you're getting your multiple choice. There's a bunch of free text in the survey as well, but that would be much more complicated to do this explanation with. So I didn't go through those, but these are some examples. So if we can go to the next slide. These are some of the things, like, and I think I have more examples on I have one last slide after this, but so these are the things that it can do. But for the waiver project specifically, if you're asking about challenges, it can provide nuance to those challenges, but it can also explain like why so you have providers who say, I was enrolled, but now I'm not enrolled, or I don't plan to be enrolled in the future or something. Okay, what was it about the way that the program worked or didn't work for you that made you make that choice, so that you can understand, and then looking at, are there certain types of providers that are giving us these answers? So you have a whole list of our providers that are being sampled, and you have this whole group that says, we will not enroll in these programs next year. You're like, okay, well, we want to understand why. And then you talk to them, and within your quantitative set, it's just a no. But then you talk to them and you find, well, this set, who are serving mostly pediatric patients, are saying they don't want to enroll because of this. This is their why. But then this set, who are serving rural patients, also said they're not going to enroll next year, but their why is different than this why. So that's what some of the interviews can blend. So some of the different challenges and benefits as they differ by provider type as well. And so then the last slide that I just added was so thinking about like what some possible interview questions are. So let's say when we get our survey data back, we find these things. Rural providers say they have more challenges with these payment models, or providers say that these things help them serve Medicaid clients, or we find that there's difference in perceived benefits for people who say they've been in the program longer versus people who haven't been in the program as long. So then we have to think about, okay, so we have these findings, and as far as the interview goes, it's a maximum variation sampling model, which means you pick people who are very different. So the goal would be like, okay, this person says this and this person says this, and so they say completely opposite things. They're going to be part of our interview sample, based on what was asked for. And there's a bunch of different types of sampling for qualitative, but that's what this project is doing. So what are some possible interview questions? Go down to the next slide, please. Okay, so, and these are just questions I made up off the top of my head while I was thinking about like what kinds of things might I ask, right? So you find rural providers have more challenges. So then one of the things you can start out with when you're talking to them is, can you explain to me your perspective on the effectiveness of alternative payment models for your organization? And they say, okay, well, they give you their thing. And you're like, okay, can you give me an example? Can I get a specific example where you feel like this what you're explaining to me has happened? And then, well, okay, so based on that, can you provide me with some suggestions about how the alternative payment models could be modified to eliminate these challenges that you're having, or suggestions that you might have to make them work more effectively for you? So that's how you can kind of delve into that response. And just as a general rule, qualitative interviews should be very conversational and should be based very much based on the feedback that you're getting from the person that you're talking to. So I always develop like 3 questions. And I say, okay, or if there's certain concepts, I make sure I have certain questions for those concepts. But a lot of the conversations like, okay, that's interesting. Could you tell me more about that? Or if you think of it from this perspective, what are your thoughts on that? What has been your experiences? So based on what the person tells you, you have to adapt and develop your questions as you're going through the interview process. So these are just examples of how you might start that conversation based on the finding that you had. And so let's say they say that these programs really help them continue serving Medicaid eligible clients. So then you might say, can you describe to me the aspects of the programs that are most helpful in making sure that your organization can do these things, can continue serving these clients? And so they might tell you, like, oh, this aspect of it. Okay, what about that aspect is most helpful? Can you think of a time where that was really a big benefit to you being able to serve Medicaid clients? So that you're actually gathering like how that mechanism works in practice. And then the last example is, let's say you find that the length of time in a program has an impact on how they view the benefits. So you really then are just asking something like, what do you think the benefits are? And then you're looking at, like, for the people who've been in the program longer, well, how have your views of the benefits changed over time? Like, how do you view them now? What was your opinion of them when you first started interacting with these payment models? And what is it that made that change about being in the program longer? Was it just like that they figured out how it works, or was there something about the program that changes opinion over time?
Chrissy,
Yes.
you get to this later, stop me. I'm curious your approach to like ordering your questions, right? Because you're using semi-structured, so you enter with some lists and then you're prepared to adapt for all of the beautiful ranges that you've made. But you have a philosophy informing why you would put certain questions in a certain place on your
Not specifically, not like a philosophy, just how I think it logically would make sense. Like if you were in a conversation, I always open with very broad, like, depending on what the study is on, kind of like, so the last study we did was on border communities. So I open with very broad, like, how do you feel working in a border community is different than a non-border community? Because if you get them talking, I've always found this, I guess this is just my personal opinion. I found once you get them like talking, they become very open and willing to share. And so then I find it just kind of flows naturally. So if that's my first question, I have a general idea that they're going to come up with potentially certain types of responses. So then if I want to also ask them at some point in the conversation what it's like interacting with Border Patrol, I know that that's probably going to come up shortly after you talk about working in a border community. So I just kind of try to structure them on like how I imagine a conversation would unfold, but there's no like scientific logic.
Can I try to summarize what I heard you say?
Yeah.
Often I find, person A says something, person B hears something different. And then it merges, and then it comes from discipline training background that the divergence is even higher. So I always found that if I try to summarize what I heard and then you hear it and we talk a little bit about it, that you can kind of close the gap a lot more. Because what I heard you say was, for you anyway, when you're doing this, kind of the most important is to think carefully about the very first question and making it broad enough so that you're not pinning them down.
Yeah.
But making sure that it's on topic, so it's broad on the right topic. And then I heard, and I'm kind of inferring between the lines, but then I heard you say, and then you have a list of questions for certain topics within that topic that you're doing, ready to go. And then you're just gonna listen to, if you have the first question properly posed and the other person is actually actively talking, that at least some subset of the questions in that list that you wanted to do a little bit of a dive on would naturally come up. And so then within that, there's not a particular order you're looking for. It's actually you have the right set list with you, and you kind of let the conversation order it based on how the conversation flows with the person you're talking to.
Yeah, I think, and I try to avoid, and this is like what I work with students on too. I try to avoid the like, okay, so what was my next question? Because people, especially I find if you're doing a sensitive topic, because people like sensitive information will come up in a lot of things. Like this project is on providing EMS services, but a lot of issues of mental health and depression, alcoholism, suicide came up in these conversations. And so I think it's making sure that the person feels you're listening to them. So not like being okay with, let's say there was one question that I really wanted to get to that just hasn't come up. Then I always try to think of like, how can I like insert this into our conversation in a way that's not gonna feel like I'm interrupting the flow of like what we're talking about. Yeah.
Great question and answers.
I don't think I have a lot more actually.
But this is fine. Actually, I don't know that you realize this because actually, I told Christy you can present on anything. Although, I would like for it to actually bring up the waiver of some kind because this is our lab seminar, and I did think our lab is very fortunate to have the evaluation project. It's very particular and it's very different from traditional academic research, but it brings with it lots of benefits. That's why we're doing it. And so I wanted everybody in our lab to at least know what it is beside the, I've heard that thing, whatever that thing is, right? So that was one aspect of it. And then since we're working on the interview and we talked about it, what you would do and you mentioned it, I did not actually, even until I showed up today, I didn't know you were gonna actually talk about a topic that I have been very interested in learning about. That's why I was like, they probably thought I told you to do this. Because I'm like, wait, you're giving me the tutorial that I've been wanting to get. So I didn't know this until I came here. But I actually got some resources from Hannah so I could read up on mixed methods. So because of exactly all the things you mentioned, apparently I'm the PI of this policy evaluation where I've never taken a theory. This is why I don't. I have a social work, I have an MSW, but that's a practice degree like MPH, and there's a class, an intro to stats, but these classes don't really talk about theory. Then I think one or two required classes that was supposed to cover theory, the instructor, the faculty is one of those faculties who just teaches it the way they want to teach it, and so I don't think the word theory ever showed up. I was supposed to do theory. I think it was supposed to be like theory was supposed to go with elderly community, and something happened during that semester, and she just kind of assigned us a really good book to read about and have a book club kind of class. I love this class, but I didn't really know what theory was. And so I have been struggling with this. So I found that I didn't know this is what we're doing, but I found it really helpful because for our evaluation, you have to know all of these things. And so I found it really helpful. I'm going to make one more comment because I really think I have to figure out. I think I'm going to probably tell Randy to the side. I think I would like to figure out how we as a lab can talk more about how the different methodologies come together. And I've said this many times. I don't know if the two of you have heard me, but I know Justin has. The whole time I've been doing 20 years of big data, I usually clash with quantitative. So the biostats people, but it can't happen because that is not how I do big data. On the other hand, whenever I'm talking to qualitative people, I love you guys. I'm like, yeah, that's the world. And the reason is because I think it really took 20 years for me to get here. But the reason is usually how you go about figuring things out in the big data. It's just the digital representation of the interview. So you're interviewing a person, I'm interviewing the data set. And so how I go about finding out what's happening in the data is the same way you go about how this person's thinking. You're kind of interrogating their brain and asking in a careful way so that you're not private. That's exactly what I do with the data. I don't go in with this positive view that there's something in there, that there's one truth that I'm trying to. I'm like, of course not. And so a lot of the paradigm that you were talking about, actually, I think it's oddly enough that it kind of feels like a circle. So the whatever traditional stats or quantitative people are in the middle, and then you have the qualitative people on this side. When it was only the two groups, right? You just have to think. Then big data came along, and they're very quantitative people. So almost everybody always kind of assumes that the big data people can think more with this paradigm or sits on this side of the paradigm and is far from this side. But actually, from day one of this, I was like, I have no idea what you're talking about, but I know what you're talking about. And I think there's just something to be sorted out and talked about and sort of that needs to get out, because people are quite confused about data science and big data from that perspective.
Yeah, that's actually really interesting because I think I don't know anything about big data, like at all, nothing. So that's actually a really interesting like perspective to think about, is that it's more of like an interrogation of the data.
Because you need all of it about that. Like, I guess when you do so when I say quantitative, I'm really talking about, hypothesis driven. I don't look at anything and I have a perfect hypothesis I'm gonna test. And then you just go test the thing, like, touch it, oh, it's true or not. And like, that's just not what you do with big data, right? And so I think I think there is something to be said about this approach, because somehow people just continue to get confused. And, more and more, as you alluded to, lots of people think qualitative just doesn't generalize as much, is not as good or whatever, right? And then on the other hand, on this way, big data there's so much points behind it. You're like, okay, this is the small sample size. Well, this is the huge sample size. So we must be generalizing. But yet how you go about like pulling things and getting things is so similar in the paradigm and all, that I feel like there is something to be sorted out here. And I don't know what that is, but I'd like to find like a group of us that makes sense, that we can kind of try to talk to, maybe even just write an opinion piece of some kind. I have for 20 years it's been on my mind. Even when I was in the MSW program, I would go to the classes with the qualitative people or talk to the qualitative faculty. I would love talking to them because we think exactly alike. And then I would go to the stats people. Okay, what are we doing? There's a way they go about things that just makes sense to me. It's very narrow. And I think that's on purpose. So like you said, it depends on your purpose, how you should go about it, right? And often my purpose is more in the exploratory, like you do in the qualitative. I think it took a while for me to realize, oh, I see, I can do the other, but I've always been more in the exploratory, figuring out what's going on. Once you figured it out, then maybe, because the other part of this is, there's deductive thinking and inductive thinking. You don't make knowledge by doing one. You make knowledge by iterating between them, right? So the quantitative way that people like the empirical study, whatever the standard science that all sciences do, it's only one way of doing it. Well, that doesn't make sense to me, right? It's an iterative process that you have to go back and forth with. Well, what about the other line? Like, because they all talk about this one line. And so I found that when I was talking, that other line happens on this side more. And that's kind of why I would do it, but it just didn't make a whole lot of sense. So anyway, I think I'm rambling. We should stop. This should be more about everybody else in the room. So I know a lot of you do more quantitative, but also we have, Regan and I think Fallon do more qualitative, or trying to do. I guess as slowly as I try to understand this, I find, I'll just say the JD people in our lab are actually the third kind of researchers, in the sense that I feel like they tend to be more on the theory side. So we talked about qualitative and quantitative, and maybe quantitative split to big data, but there's also something totally separate from all of this. That theory that we were talking about, well, it doesn't fall from the sky. I don't know my question always was, okay, well, where does the theory come from? Like, okay, I call it a theory, it's a theory, where is it? Where does it fall from the sky?
Right. On that note, actually, I was going to say, I have a philosophy background, so that was my undergrad. And so I love this type of thing. And theory is kind of the foundation of everything. I was even really interested in jurisprudence throughout law school. But I was really curious because when you're talking about positivism, to me, positivism means something else, I think, than what we put it in the context of this. Because I recall, it has been several years now, but I do recall framing positivism as more of a counterpoint to metaphysics and theism. It's basically more about the fact that there is a scientific way to confirm or deny any given logical statement or any given logical hypothesis or anything like that. That we don't need to seek outside of the scientific and the research realm to answer any given questions. So it's really fascinating for me to hear it, because to me, in that kind of previous thing, I'm like, well, we're all positivists, right? We think that we can go and answer questions in the world. It's especially in regards to our research, we're gonna go and actually do the scientific method to find it out. But I find it really interesting that you can frame positivism, at least, in the context of theory of research, in a way that it's like, okay, you're seeking out one single truth, that throughout these investigative processes, you can get to a single truth, as opposed to constructionist, which is not a term I'm as familiar with, but that maybe there's different truths based off of different contexts. I found that really interesting because it's never been a frame with which I've ever viewed positivism in. So I thought that was really neat.
Yeah, that's it. And I will say, like, all of my theory training is in the social sciences. So there's probably a positivism fits this way and that, and because we didn't talk about metaphysics.
Yeah,
So
that's totally what I assumed.
But yeah.
In different contexts of different, theory courses or contexts of theory, again, research context, it makes a lot of sense. But yeah, because positivism, like as a super broad philosophical concept, was kind of taught to me as a means of thinking about the world.
Mhm.
Like, can your questions necessarily be answered through scientific pursuit, or do you have to go outside of that? Do you have to go into the realm of metaphysics or theology or something like that? It was really neat. I actually like that a lot. Now I'm more interested in the theory of research.
Yeah, so I guess I would say, I have gotten questions from people like, what is research? Or I want to do research, like what is the definition for it? And I would say, it's my personal opinion, but I think research just is knowledge generation. And knowledge gets generated, different types of knowledge get generated with different activities. Some of those are empirically based and more the traditional quantitative. You think about a hypothesis and you test it in the way that you're supposed to do it correctly, and you can say something about that hypothesis in a particular way. Some of it is exploratory. You explore things and or like I always talk about physics. Like, okay, so I found a star. There is no hypothesis there. I found a star. That is knowledge generation, right? That is sufficient for a paper, right? So it depends on what it is that you are doing and the kinds of knowledge that you are trying to now I would say, I found a star. If you found a star, you're gonna study the star to actually generate knowledge about it. So you have a topic, and then you're trying to do some activities to learn about it, such that you can actually write about the knowledge that you generated, so that it's beyond just what you learned, right? And that's how kind of I think about it. One of those includes actually writing theoretical papers that kind of try to take all the different knowledges that have been happening and try to put it together in a coherent, logical framework that then is written up in such of a coherent, logical framework that then other people can pick up, other people who are less trained in putting such a framework together or are more, because typically in general, people learn to use those frameworks out there. Like, if I'm gonna do this topic, I should go look up the theories related to this topic. And those theories are typically constructed in a framework with logic in a way that where you have logical thinking. And so those are the different things that happen. And I guess I do find in our lab, we actually do all of the above. So we have big data activity that there's kind of that. We have the traditional hypothesis testing, quantitative, health econ kind of activity, epi kind of activity, although epi includes the qualitative and mixed method, as well as the more theoretical writing that Casey kind of does more of, and that happens more in the JV space that I've been getting more into. So that's to me how kind of all this comes together. But as I said, we'll open it up for other people, if you want to ask questions or just even, general comments on what we've talked about today.
I have a question about, I guess, survey. Is the survey considered more qualitative than it is quantitative?
no.
Okay.
So this is what I always tell people, and people will argue it, but I feel pretty strongly that surveys are quantitative methods. You can add free text, have a qualitative component, but survey research is not qualitative. That's a good question, because a lot of people will tell me, I do qualitative methods, I do surveys. I'm like,
Yeah. Actually, I would say that's the wrong words to use. So I find that because I jump around so many different fields, it's all about the right words and the right definitions behind it. I think the word qualitative and in that context is not precise enough to what you're trying to get at. What I think I would, if someone said that, I would say, actually, are you talking about doing open-ended survey questions or doing interviews? Those are two different things, and nobody should think of them as the same. But if you're trying to somehow be not precise in your thinking and you're just saying that, that's why it's confusing. I think knowing concretely, well, yes, for this I need interviews. You wouldn't confuse that with open-ended, type of what you want. But you would also not confuse that with survey questions that are likely. So I think that you just have to, for what you're doing, the preciseness of the words you use and the concepts you have and the way you talk really does change it.
And just to add on to that, I feel like really you have to start with like, what am I trying to understand? Because whatever you're trying to understand is going to matter for your design and which methods you use and your assumptions that you're making and your theory that you apply. So like really that's where it starts, and then you figure out, do I need open-ended survey questions or do I need to do an interview?
Okay, just the perfect time. We're all sharing opinions about the research.
Yeah, Christy and I, we were at a Pilates class having a, having a conversation about, how you were introducing the students to theory in your class. And this was kind of something that also as I terms experience is easy for folks to kind of gloss over in their training. And I think you asked me like what was my introduction to theory when I was doing this. And there was kind of like a little welcome kiss from it in most classes. I'm like, okay, here's like one theory that works a lot of the time, and then it's never touched on again, right? So like, when we think of theory in HSR, a lot of times we talk about frameworks like Henderson and Thomas and Pachansky. We're thinking about like how people access healthcare and what are the constructs that inform whether or not that access exists or the extent to which that access exists. Or if we're thinking in a public health context, right, we have our socioecological model that tells us that the outcomes that we experience at an individual level are a function of our individual determinants like our age, our relational determinants like the eating habits that were in our home as kids, our community determinants like whether there's a bunch of lead paint around, and our societal determinants that are a whole slew of things. And or like with the JV research in the lab, the one framework that comes to mind is like Scott Burris logic model, where you have your inputs, what is it? Inputs, outputs, something. I'm butchering this. Anyways, Scott Burris has a graphic that essentially says if we put a good policy in, there's an implementation process and potentially good population health outcomes come out, right? But even if we don't have the explicit, here is this thing and there's a name attached to it and someone has published it, I think it's important to recognize that the research questions that we're asking in this room, we're asking from sort of some sort of theoretical place, from some type of assumption, right? No one in the School of Public Health is doing research on the extent to which consuming peanut butter every day makes your toenails grow faster, right? There's no reason to think that that's the thing, right? So even if we don't have a name to attach to it, it's very important, and if at all possible, we should, right, have done our due diligence and found a good theoretical framework. But even beyond that, even if a broad, deep theory introduction isn't something that we have to understanding that my research question is coming from somewhere and drawing from some body of knowledge, from some system of thinking to even be able to start this research process. And I think that's valuable. Thank you for the walkthrough of the different kind of theory backbones for mixed methods.
So I'm going to be a devil's advocate because you had said some of the stuff that is I can agree to, but the first thing is actually I agree that a lot of work we do in research should be theory-based, although I still wonder what that word means anyway, but as I said, theory doesn't fall from the sky, but theory is not theorem. So theorems are mathematically proven, yeah, although you can get it wrong, right? So theorems tend to be like correct, right? Theories are actually not, as far as I understand what a theory is, that is, my understanding is, if enough people write about it, then it becomes a theory at one point because we all agree that it is a theory, which also means it could be wrong, and there's a whole lot of people who are wrong until we figure out that it is wrong. That would be called the Earth is flat. That was a theory where the whole world believed it for many, many years until we realized we were wrong. And that is the fundamental nature of theory. That's why it's not a theorem. So I think it's kind of actually important. If you imagine this, who do you think would find the theories that are wrong and fix it? The non-researchers? The non-academic? No. If you're the researcher and the academic, and you're the one, you are basing all of your work on theories, you are also the one responsible to have a critical mind and start to notice when your theory isn't working.
Yeah.
And
I
which, sorry, you go ahead.
No, I was gonna say, I actually think like both of you are accurate, and this is again my kind of opinion of it, but I think both of you are accurate because you're right. Theories aren't true. They're what we've decided at that point in time. And as I did a lot of training in political science, and there are people who spend their whole career just arguing about theories and critiquing theories and stuff like that. So, but I also think, you know, making sure that you know which assumptions you are placing on your research so that you, even if the theory isn't always correct, like knowing what theory you're operating in so you know your assumptions. So I think actually you're both, you guys,
Yeah,
so the way I'm hearing it is that you're both saying different parts of.
Yeah, so I think that's where, if you go back to how do you be a good researcher, I think it's actually, theories are supposed to be, as far as I can understand it, you have to be able to put together a logical framework that you can explain in a coherent way for it to have a name and to give it a theory. And once you've done that, you have to have enough people also agree that's logically flowing. And then at some point, there are studies that actually support the logic and see. So here's study one that says, yeah, that logic works here and here and here. And then that becomes a theory that people put a name on until we realize, whoops, there was something wrong. All of those logic is built on assumptions. So you kind of have to know exactly what are the assumptions. If those assumptions were all correct, then this theory is true. And then usually where you find out, okay, wait, you were wrong because that key assumption was wrong.
Yeah.
And then you figure out that's when things start to break out. So I think being a good researcher or being trained to be a good researcher is actually learning to be able to think through that logic, which is that logical thinking that I was talking about. It's a little bit different than critical thinking, but I think if you want to be trained as a good researcher, I think the two key things that you're trying to train for, and I think that continues forever because I'm still working on it, is logical thinking and critical thinking. And that's what builds on. And what the other thing that you said that I felt was very important is when you are doing research, you shouldn't be just, hey, this looks interesting. It should be grounded on something. And that's where literature comes in. So I don't know that I would say, like, as a truth statement, that it should be grounded on theory. Not because the other thing, because I tend to spend more time in this space than the typical average person, in that whatever new topic it is, there is no theory. So if you have to always be, because this is what I would argue when I was like a junior person or a student with the faculty who do theories, because I come from a background where we don't talk about theories, we only do theorem. So I come in and they're like theory, everything's theory. I was like, okay, well, what if there is no theory? Well, we don't. It's out of touch. We don't get to research that. What? So what? It just falls from the sky, and that's what we see. Where do you start? How do you get going? Right? That would mean you'd have to make the theory, right? And yes, again, it's not the non-academic people that's going to get this figured out. Like, we didn't have the internet before, so the internet shows up. No research on the internet because there's no theory on the internet. Well, right? So I think this is where you actually have to have a base to go off of on. Often it is theory, but it doesn't have to be theory. I think the most important thing is actually it is based on a set of literature that is most relevant to what it is you're doing. But some people call this alpha research versus beta research. There is a whole lot more beta research than alpha research, where alpha research it is creating a new thing. Versus beta research is you take what's existing and you are incrementally growing it, right? It is much easier to do beta research than alpha research. Obviously, alpha research tends to have more impact, but usually alpha research is also much more risky. So, some people call this high risk research, right? But regardless, it should be based off of whatever our current knowledge is. So I think of it as, we talked about generating knowledge as research. Well, you have a base of knowledge and you are kind of trying to go to the edge of that base that we know as a society and then go the next step. And if it's the case that actually the next step is a baby step, that's the beta thing, one more step out, that a lot of people are doing that. But then you get to a field where it's kind of no man's land. It's a new thing that, a new star that we found or a new phenomena that occurred. Then the closest to that thing is kind of far. But still, you're not going to just jump into it and just make something up. You're going to go to the closest thing to there and then have to make a further step out to even touch that thing. That tends to be more alpha research. And I guess I spent a lot of time thinking about this because for whatever reason, I tend to do more alpha stuff and I tend to be more interested in more alpha stuff. Then I realized, oh, this is not the thing to be doing. Because the other part of this that is really important is the fact that because we are all doing things that no one knows the answers to, you don't have anyone who can grade you. So no one knows whether what you did is correct or not. And so the only thing that you can do is actually talk to people who are around you interested in the same thing. Those are called the peer group. And so if you're in this alpha space, you don't have theory, you don't even have a peer group. So you're out there because you're interested in that. Most other people aren't there because they haven't figured out that they're interested or they haven't noticed the star yet, right? And then you don't have a peer group. So it's really hard to kind of get to a point where you say, then the first thing you have to do is get enough people to look at it. See, there's a star over there. There's a star over there. Can you take a look at the star over there? Before you can even do research on the star. So it takes a lot more to get anywhere. And it took a while for me to realize I should stop doing this alpha research.
Yeah. Have you heard of grounded theory? Have people in here heard of grounded? Yeah.
So that's here. I mean, I think some of us have, but some of us haven't.
Yeah, I think that is used a lot in qualitative methods, but for this idea of we don't have a theory for it. We have this thing that we observe that's happening, but we don't really understand it and we don't have anything to frame it. And so then the iterative data collection until you can feel confident that you have enough of an understanding to then create a framework theory.
I wanted to say I find it really fascinating too. I feel like initially there was a bit of kind of a semantics issue with what we were kind of defining theory as. But now I understand we've kind of come to the point that we're talking about established theoretical frameworks, and it's really fascinating coming from a field of philosophy, which I didn't get to do as much research in as I'd like to. But in the little amount of research that I did get to do, everything is theory in philosophy. Nobody's in, maybe aside from some kind of niche ethical and niche fields, almost everyone in philosophy is still arguing over the same stuff we've been arguing over for the last 2,000 years or more. So, and you're just fighting back and forth. Papers are just criticizing other papers, and theory, things are coming out that you're constantly just doing what you said, being critical, because that's the entire field of philosophy. So it's really fascinating kind of to come out into the research that we do here, which is so not that. A lot of times you don't go read other articles and then write an article about why they're wrong. Most of the time you're doing your own, research and then kind of coming to conclusions or drawing conclusions based off of that. And if a certain framework helps, then you pull it in, you use that theory to support it. But it is really fascinating. There are entire fields that approach theory so differently just based off of, the way that those fields operate. Here, it's data collection. We're answering questions about relevant things in Medicare policy or whatever. In philosophy, it matters a lot more if the person who just published this paper on this specific ethical principle got it wrong. There's really not a lot for us to be critiquing, but I do like the emphasis that we really ought to be critical about the theories and frameworks that we do implement or integrate.
Ashley's a really cool sticker on her laptop. This is polio, neither, thanks, science.
Love that.
Someone read
A
it.
testament to the value of research.
Someone read that a little bit slower so everybody else can be doing the conversation.
You got polio, me neither, thanks, science.
That's so awesome. I feel like I recently heard on NPR about polio going on so much.
I think there's been a lot of discussion of polio vaccination in the area of conflict.
That's what I was,
Yeah.
so it's back.
Oh.
Well, anyway, this was a really good seminar. It's a good, I feel like it was a good kickoff for this semester. And I don't think